Welcome back to our special on varicose veins. If you've been putting off getting treatment, stay tuned. You're about to find out about the latest treatment options, how to get insurance coverage, and why you should get treated as soon as possible. On today's show, you met a woman who was treated for varicose veins, but did you know 18% of men suffer from this condition? Frank Szymanski is one of hundreds of men who turn to Georgia Vein specialists for help. Frank Szymanski is walking around town with his wife. That's quite an accomplishment, considering he used to be in constant pain caused by varicose veins.
My problems were when my legs were always swollen and also hurting. And every time I went to the doctor, they say, oh, you have varicose veins and it's cosmetic. Well, I know it wasn't cosmetic because it hurt.
Frank is not alone. Some 18% of men have them, and like Frank, many of them suffer for years before getting help.
Our male patients tend to have a further progression of disease. I think there's a number of factors. One is that they're not as interested in cosmetics. You know, it's okay, my legs don't have to look perfect, but sometimes they don't equate the veins in their legs to that fatigue and tiredness and aching they're having at the end of the day, that they may be related.
Dr. Ashutosh Rao saw Frank and assured him today's new treatments are much easier than what he endured years ago.
In the old days, which was all of the late 90s, it used to be a hospitalization, and usually 3 or 4 days, and people would actually have the actual veins stripped out. Now what people are doing is using lasers, and it's a minimally invasive option. You just have a Band-Aid when you're done, and most importantly, it's done, number one, as an outpatient, and number two, as soon as you're done, you get to be on your feet and walk out and drive yourself home.
What I went through before years ago was staying on the table, of course, and thousands of needles injected into me.
Frank wasn't just concerned about the appearance and the pain. He was also concerned about possibly having hardening of the arteries or blood clots. The first step for treatment here at Georgia Vein Specialist is always a thorough ultrasound done by a doctor.
In many practices, you have one person that does the ultrasound, another person that looks at the results of the ultrasound, and maybe even another person that does the procedure. But I think that there's room for error there. I think that a physician who's trained, especially has done a residency using ultrasound. This is all about the ultrasound diagnosis of varicose veins and then the ultrasound guided treatment. At Georgia Vein Specialists, all the physicians that do this have had a specific residency training in ultrasound, so we don't miss subtle aspects of the disease.
I love the fact that they were able to ultrasound it before the treatment also and find out where the problem is and not just do it at random.
Here at Georgia Vein Specialist, the same doctor who does the ultrasound does the procedure and the follow-up.
I felt that he was very professional and that I had continuity with the same doctor.
Frank says his experience was so easy, he just wishes he would have done it sooner.
The experience before was night and day, you know, coming in here in a professional atmosphere, number one, and also when it came to actually doing the procedure, it was in and out. I mean, before I knew it, it was over with, you know.
Frank had what's called EVLT, endovenous laser treatment. It involves the doctor making a small incision, then injecting the vein with an anesthesia and inserting a laser to destroy the vein. Frank says his pain during the procedure was minimal, and actually wearing the compression hose was the most uncomfortable part. Dr. Rouse says too many male patients just put up with the pain, but varicose veins do get worse.
The last stage of the disease is actual skin breakdown, and we certainly see patients that have ulcers on their feet that are either bleeding or oozing fluid, that once you fix the veins, then the ulcer completely heals itself.
Most insurance companies cover the initial evaluation and treatment.
And so it's important to come in, especially when you have symptoms in your legs that get worse, when you've been on your feet all day, have been very active, and when you lay down and put your feet up, those symptoms are much, much better. Those are very classic symptoms of varicose vein disease, because when you're up on your feet, your blood wants to rush down towards your feet, and if your veins aren't competent at sending blood back up to your heart, that's exactly what causes the symptoms.
Dr. Rao has treated countless male patients, most of whom want relief from the pain. These are before and after photos of a firefighter whose varicose veins could have caused serious injury.
He has a big, large, ropey varicose vein that is protruding to his skin, and it's definitely unpleasant to look at, but it's also dangerous in certain fields like a firefighter. If you were to get a minor cut on your leg while doing something very active, you could have a significant amount of blood loss.
Dr. Rao says varicose veins should be treated as early in the disease as possible. You'll be out of pain sooner, get a better cosmetic result, and avoid skin problems. And once treated, people can exercise longer and feel better. Frank certainly does.
I came in here and they put my mind at ease, they took care of it, and it's gone. So what more can you say other than results?
Georgia Vein Specialist is known for having doctors who specialize in the treatment of varicose veins and having the same doctor stay with the patient from ultrasound through follow-up. Diane Hogg, who needs sclerotherapy on a regular basis, says she prefers having a trusted physician do the procedure.
I've had sclerotherapy done elsewhere, and typically it's been a technician or a nurse that's done the procedure or the ultrasound, and I much prefer that it was the doctor walked me all the way through this. I think you get the continuity of treatment, and gosh, you're really sure that you're having the expert looking at your legs.
Georgia Vein Specialist is often the Atlanta office doctors turn to when they need treatment for varicose veins. Dr. Scott Early says he knew the doctors are specialized, and that's why he turned to them for endovenous laser treatment.
I was very comfortable with the physicians at Georgia Vein Specialist. I knew their level of expertise and skill in a particular topic, and I thought that they would be some of the most qualified people in the area to perform the procedure.
So now you have the facts, and it's up to you. You don't have to suffer from varicose veins. The treatment is simple, effective, and relatively pain-free. You don't have to endure surgery and weeks of recovery. The new laser EVLT means you only have a local anesthetic. Most insurance companies, including Blue Cross Blue Shield, cover treatment for varicose veins. Medicare covers the treatment as well. So if you or a loved one has varicose veins, please go to our website at gavein.com and find out more. Thanks for joining us today.
Tired of painful, unsightly varicose veins? Want healthy, beautiful, pain-free legs? If you have dull, aching pain, heaviness, itching, or swelling on your legs, call Georgia Vein Specialist to schedule an evaluation by a board-certified MD. In-office procedure in about an hour.
The laser procedure has been terrific. Patients resume normal activities quickly, and the results are usually dramatic.
I often felt self-conscious about the way my legs looked, but after a simple procedure at Georgia Vein Specialist, I can wear short skirts again, and I feel great.
For healthy, beautiful legs, call Georgia Vein Specialist.